Happy to be here with you and tell you a little about the upcoming webinar that I have coming up this Monday, January 30th. And it's teaching you skills, trauma-informed skills and practices to help you work with your clients with emotional and/or any disordered eating. So I think we've all been there as clinicians with the uncertainty of how to help our clients when they are expressing their their troubled, disordered, struggling relationship with food and/or their body. And usually what I say with that is really what they're expressing is unfortunately their lack of relationship with food and their body. And one of the reasons that they feel this lack of relationship, and we hear their wording time and time again, is because they're struggling with their hunger and fullness cues. And we often hear our clients saying things like, I really can't feel or sense a register of these cues. And those aren't just words that they're saying, they're actually a very real occurrence, right? So I want to really highlight that what they're saying is actually happening for them, is that they're having a really hard time in sensing in to their internal body and being able to register these cues, and then also being able to respond appropriately to the sensory experience that they're noticing and not noticing inside. So we can say that there's been a disruption of this sensory experience, and there's a word for this, and the important word for this is a neuroscience term called interoceptive awareness. And in this webinar, we're going to be taking a deep dive into learning what interoceptive awareness is, as well as helping our clients to bring that on board through very specific skills and practices that I'll be teaching you. And we're going to spend a little time today in the short time frame where I'll be guiding you through a simple practice that will introduce you to some of that. But before we go on, I want to just tell you a little bit more about interoceptive awareness. So the simple definition for now is it is about the internal register of our sensory experience. So it's not what we think about the body, it's what we are sensing from inside the body, and then processing that and being able to respond to it in a different way, in an appropriate way, right, in a non-reactive way. So, interoceptive awareness, why are these cues disrupted for the clients that we're working with? And they're disrupted for very good reasons. So, first off, it is something that we're all born with to varying degrees, actually develops in utero and then continues to either develop or gets hindered and disrupted along the way. And some of those disruptors are things like chronic dieting, which unfortunately, this is what our clientele has been subjected to, many of them for much of their life, right? We hear them say this. Another disruptor of these internal sensory signals is trauma. And I think that we all know that our clients, most of our clients are reporting that and have a history of some level of trauma, and that has affected their relationship with their body and food. And the other is any neurodiversity. So we can get that history and gather that history from our clients. And if we hear that, we know that these cues will have some disruption, different levels, again, varying degrees. And the other is any co-occurring mood disorders. And again, that's a very typical piece that we'll hear from most of our clients struggling as well. So very good reasons that these cues are interrupted. And the good news, though, is that we can help our clients to bring these back on board. And that is what this webinar will cover. in a great deal. I'll be introducing you to a lot of psychoeducation about the nervous system, because we're going to really dive into understanding the connection between the autonomic nervous system and states of the autonomic nervous system and interoceptive awareness. We will also be practicing a lot, learning these skills for yourself. So very important. I always say we have to, as clinicians and practitioners, learn these somatic skills and experiences ourselves before we can deliver them to our clients. Um, and uh, and yeah, we'll be taking a deep dive into all of this. So what I'd like to do now is just introduce you briefly to a practice that we'll be exploring fully when we're together. And this little practice, I won't be able to take you through the full practice, so I'll take you through a partial body scan. And this partial body scan, we're just going to do a scan of the upper body, and this is an introduction to interoceptive awareness. So there are stages of developing this. We can't just, come on board and ask our clients to start registering what's happening inside their body. There's actually stages of its development. And the first stage in its development is something we call body literacy. And that is beginning to just gather sensory experience, know the difference between exteroception and interoception. So notice the difference between obvious sensory awareness and then internal sensory awareness, two different things. And then I'll be asking you and guiding you to start taking notice of the internal sensory experience and kind of hang out with it for a bit and describe it. And so those are some of the stages, again, that we'll be going into fully in the webinar. But for now, I would like you to join me, if you're able to, by just taking a comfortable seat. This practice will be seated. And I invite you to either close your eyes or take them into a soft, fixed gaze. Rather than keeping them open. And there's a reason for that. As soon as we close the eyes, or at least keep them in a soft fixed gaze, we take away the external sensory stimulation, and that actually helps our brain to focus inward. So if your clients are uncomfortable closing the eyes, which again is a trauma sensitive piece, so invitation to let them keep their eyes partially open, just to a soft gaze. And just take a couple of breaths. So I like to offer a release breath in through the nose, exhale through the mouth. Just a nice breath to kind of reset the moment and come back to the present. And I'll invite you to pay attention, just draw your attention to the crown of your head. And I'm just going to guide you downward a bit here. So you can draw your attention now into your face, particularly the eyes. Just notice any sensation that is present in the eyes or in the jaw. So you can take a little movement here in the jaw, whether that is open and closed or side to side. And what we're noticing along the way is any sensation that stands out for you. Okay, so anything that kind of grabs your attention. And we'll come back and now start to notice the area of the neck. So what I invite you to do is maybe tuck the chin a bit and then lift it up, so that gives you access to the front and back of your neck. You can also tip your head side to side, and that's going to start to increase your awareness into what's happening in the large muscles along the side of the neck. And if anything stands out, again, we're just noting it. Like, when I tip my head to this side, I'm like, oh, yes, tightness here, I notice. So then we'll go on. We're just going to note it, like a little, sort of put a little pin in it there and note that. And then we'll go on to the shoulders, and you can move the shoulders back and front and sort of notice right to left, even down the arms. So sometimes the arms is not an easy place to register. So you can turn the arms and can squeeze the hands in and open. And then into the upper part of the front of the body. If we roll those shoulders back, we sort of expand that area, just noticing sensation, and can roll the shoulders in, and that upper back starts to become alive a bit. And then awareness down the length of the spine. If you sort of just let your seat rest into the support beneath you, you'll get a little bit of a sense of the back body and the lower back. And then if you press into your seat and lengthen up the spine, you'll get a sense of both the back body and the front body. So just noticing anything that stands out. And then I'll have you take a deep breath and release and just stay for a moment. And we're going to start just with some of that external awareness first. So I want you to just register the temperature around you. So the temperature of the air in your room. Is it cool? Is it warm? Is it hot? And then we can come to notice the temperature of different areas of your body. So that may be kind of obvious. Maybe hands are cooler than the center of your body or your face. So you can even use your hands to kind of register that temperature. And now we're going to come back to those little areas that you kind of put a pin in there saying, oh, yes, that stood out for me. Like I mentioned, this side of my neck really stood out for me in a lot of sensation. So we want to come back to an area that stood out, having a lot of sensation. And now, what I'd like you to do is just place a hand or fingertips to that area. And if it's an area that's hard to reach, like maybe your back body stood out for you, I'll ask you for the purpose of this particular practice to come to an area that you can easily bring touch to at this point. And I'll say more about that in the webinar. But for now, let's pick an area that we actually can reach and take some actual touch to. And there's a reason that this is important, because we are starting once again with the external awareness, which is just what it's like to take a hand to that area, kind of skin to skin, and take a little pressure to the area. So it's almost like a little massage, but it's a massage to bring attention to what's happening there, not for at this point in time, not for release or relaxation, right? So what's happening is as we attend here, I'll guide you through really starting to notice now what you kind of feel underneath. So, what you feel underneath the fingertips. Like if I'm to describe what I feel underneath my fingertips at this point in the actual tissue of this area, and then even into the muscle beneath the tissue in this area, I can feel like a big rope. I can feel like a hardness to the tissue different than this side. This side, I don't have as much sensation. So we're kind of feeling a right inside, if we can get a register and a sense of what we're actually touching and what it may feel like, and describe it from the inside. So does it feel hard or soft? Does it feel lumpy or stuck? Sometimes the tissue can feel ropey. We can also get a sense of the size, like what we imagine this sensation, how large it is inside. Is it something that kind of goes from top to bottom here? Is it round? Is it pinpoint sensation, or is it larger? So now that you have a register and description of kind of what's in there, I want you to just hang out there for a moment. So we're just going to slow it down and quiet it down. So you and I will just stay quiet for just a few breaths. And then I'm going to have you slowly come back to just moving the fingertips or hand around again. And this is very subtle sometimes. I want you to just tune in to see if there's anything that may be a little bit different here. Doesn't have to be, there's no right or wrong to any of these practices. This is all just beginning to draw attention inward. So there's never any right or wrong to these somatic experiences, but we're just checking in to see if there's any difference at all, any subtle shift or change. And then you can release the hand and again, just stay with eyes closed or that soft gaze, just tuning in. Maybe even moving that area around again. So it's interesting when I do this tipping back and forth again of my head, I actually don't notice a difference now between the right or left side. So for myself, there has been a shift in that experience, that internal experience. So just notice that for yourself now. Again, no right or wrong, whether there is or not, just an awareness. And then we'll come back by taking a deep breath in and exhale. And that is the very, very beginning of what we'll be taking a deep dive into together in the webinar, really understanding this practice. And I think what you may appreciate is I'm excited in this particular webinar. I also have 2 demonstrations, 2 recorded demonstrations of me guiding both this stage and another stage of interoceptive awareness practice where you can actually see the application. So I kind of personally love demos like that because I think you can really see and we can discuss together what you're noticing as I guide someone through. So I hope that you can take just this tiny practice and begin to explore this yourself. As I said, so important as developing somatic practitioners that we really begin to be able to get this register and tune in ourselves and practice with that. And I really hope that you can join me on Monday for the full webinar, where I really hope that will be a very rich and full learning experience together, learning the skills that are really necessary, I think, for us as practitioners and for our clients to move forward. So thank you.